Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing the medication known as Gemfibrozil. Its brand name is Lopid. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find this information to be valuable, please consider leaving a like on the video, as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how Gemfibrozil works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Gemfibrozil. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects with percentages. So how does Gemfibrozil work? Well, it causes its lipid-lowering effects via stimulation of the peroxisome proliferator activated receptor alpha. This causes a decrease in triglyceride levels and an increase in HDL levels. Now, in terms of indications or reasons we would prescribe this medication to a patient, we often see it used in familial hyperlipidemia. It can be used to lower triglycerides. We also see it in patients with type 4 and 5 hyperlipidemia who are at risk of pancreatitis. With respect to contraindications or reasons we would not be able to prescribe Gemfibrozil, we wouldn't give it to a patient who had a hypersensitivity to Gemfibrozil or to any other component of the formulation. We also wouldn't give it to patients who have gallbladder disease or severe kidney dysfunction, as well as patients who have liver dysfunction. Now what about dosing with Gemfibrozil? So in the treatment of familial combined hyperlipidemia or familial type 5 hyperlipoproteinemia, we would typically see 600 milligrams orally twice daily, given 30 minutes before the morning and evening meal. As with all medications, there are some side effects or adverse reactions that patients may experience while using Gemfibrozil, so I'll go over some of those here now. About 9% of patients may experience abdominal pain, while 1% may experience acute appendicitis. Indigestion seems to happen 20% of the time. Now, a more rare but serious side effect would be rhabdomyolysis. That's all we're going to talk about today with Gemfibrozil or Lopid. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.